I'm Dr. Bhavana Mittal. So today I would like to discuss a topic which is Ovarian Hyperstimulation Syndrome. So there are some frequently asked questions about ovarian hyperstimulation. So what are the key risk factors for ovarian hyperstimulation? Ovarian hyperstimulation is seen more commonly in patients of young age, lower BMI, also patients with a higher ovarian reserve. Higher ovarian reserve we judge by checking the antral follicular count on ultrasound and doing blood test for ovarian reserve like anti-Mullerian hormone level. Also, if the patient has had previous stimulation, then if previously also the response has been on hyper side, that also is a risk for hyperstimulation. It is very important to recognize the patients who are at risk for hyperstimulation and tailor their stimulation protocol accordingly. Now, second comes the question that how can we prevent or reduce the risk of hyperstimulation? So first of all, it is very important to identify the patients at risk of hyperstimulation. As I've outlined in the previous question, that if you have such a patient who is young, lower BMI, higher ovarian reserve, or who has had a previous high stimulation, then we need to be careful in these patients. Also, by tailoring the stimulation protocol and the drugs which we use and the doses which we use, we can reduce the risk of hyperstimulation. A GnRH antagonist protocol also reduces risk of hyperstimulation, and most importantly, the trigger that we give, that instead of HCG, if we give GnRH agonist trigger, that can to a very large extent prevent hyperstimulation. Also, not transferring the embryos in the fresh cycle and freezing the embryos can reduce the risk. Patient education during this treatment and all this decision making is of very paramount importance. Now coming to the question that if after all our effort patient lands up in hyperstimulation, how do we manage this patient? The management of this patient will depend on the severity of hyperstimulation. Mild to moderate cases can be managed at home by symptomatic and supportive treatment. However, patients who have severe hyperstimulation have to be hospitalized. Treatment goes on two lines. One is a symptomatic management to manage whatever the symptoms and difficulties the patient is having. And the second is on the lines of managing the complications. Especially, it's very important to be careful about blood coagulation as blood becomes hypercoagulable in this condition. And also, there is a tendency towards third spacing, that fluids get accumulated in the abdomen, in the chest, and so at times we need to give treatment to reduce the collection of fluid in third space, and also sometimes we even need to drain the fluid from there. All throughout, the main goal is to ensure the safety of the patient and also at the same time to give her a better chance for pregnancy. Thank you so much.